Amoxicillin is an antibiotic that is commonly used to treat bacterial infections in children. This includes infections of the ear, nose and throat area and also infections of the chest. It is a very common antibiotic and its use is fairly wide ranging, so it can also be used to treat infections such as infections of the urinary tract because it's a very well absorbed antibiotic. It's very important to know that because it's an antibiotic, that its use is for the treatment of bacterial infections, and this means that it's of no benefit whatsoever in treating children who have viral infections such as the common cold. Because it's part of the penicillin group of antibiotics, if you're allergic to penicillins, then you'll also be allergic to amoxicillin, and this is a really important point to make. In terms of its administration, it's usually given 3 times per day, but the dose that's given for a child is calculated on the child's weight or the child's age, and your GP or paediatrician will calculate the right dose for your child. And this is a really important point because children vary in terms of their size as they grow, and so the dose that's needed is specific to your individual child. One of the questions that parents often have is what happens if a child vomits after being given their antibiotic. This is quite common. That's the first thing to say. It's important to note that if a child has been given medication and vomits within 30 minutes, then as a rule of thumb it's okay to repeat the dose because you can assume that the drug has been absorbed. If more than 30 minutes has passed since the drug was administered, then you should assume that the drug's been absorbed and therefore you shouldn't repeat the dose. So only give a repeat dose if the child vomits within 30 minutes of being given the dose. So what are the side effects of amoxicillin? Well, there are some minor side effects such as gastrointestinal upset, where you may get an upset tummy or some diarrhea, which is relatively mild. However, if this persists for more than 24 hours or is severe in nature, then you should seek medical help from your general practitioner. There are some more important side effects which need addressing, and that includes side effects which constitute an allergic type reaction. So if your child were to develop a rash or itching, or if they would develop some wheeze or shortness of breath, then this would indicate that an allergy was underway. More important, if the reaction is severe, so if they had face, lip or tongue swelling, then this means that they've got a severe allergic reaction underway, and this needs medical intervention, either by taking your child to hospital or if it's severe enough to call an ambulance. We do have extra information on the webpage to supplement this patient education video, so please refer to that, and I hope that this helps in managing your child at home.